We may be just 24 hours away from the crucial Karnataka polls, but let me tell you, these polls will be incomplete till I speak to some of the most learned and erudite people of this famous city. Joining me today on this show ahead of the elections is someone who actually won the hearts of this country when he performed a surgery on a 21-day-old Ronnie and went on to become country's biggest cardiac surgeons ever India has produced. Welcome to the show, Dr. Shetty. What an
Thanks a lot for the generous introduction.
but what an incredible career that you have had over the last 3 decades or so. I would rather say that it's you who people see as the beacon of hope when they see themselves getting into a crisis, because they realize that he's there to help us ensure that our life is in the safe hands. How proud do you feel today?
I am very privileged. I am grateful to the God for putting me in this position. Thanks. Thanks.
Now that I realize that, of course, elections are about 24 hours to go from here. You are someone who is seen as one of the most learned faces, because not only because you were awarded with the Padma award many years back, but also because Karnataka's large part of population comes to you, especially those who want to go for an affordable surgery, and when they're in crisis, they run to you. So how excited you are for tomorrow's election, that the new government may be elected?
Yeah, I'm very excited. As you know, we are very privileged in Karnataka that we always had a responsible government, and I'm hoping it will continue. Yes.
Right. What I mean to also ask you is that let's say if we talk about the changes which Karnataka has seen as far as healthcare sector, education, roads, development, infra, IT services, and so on, so are concerned, because your job is also to interact with those people of the civil society who actually help form the policies at times as well. How satisfied you feel as far as the infra or education or private sector reforms are concerned in this state as well, and what are the changes that you have observed?
We are very, very privileged because from the day of independence till now, we always had governments encouraging education, skill building, and of course, at later date, healthcare became a big issue. And we are privileged in taking several of the initiatives in this state to reach out to the common man.
Right. Dr. Shetty, you're also someone who enjoys a great degree of respect among all the political parties. I don't want to, of course, drag you into any political controversy. It'll be inappropriate for me to do that. But let me tell you that the country's leading politicians look up to you for your wealth of intellect, and also for your ability to tell them where they are doing wrong. Is this something that you found correct or wrong in the present government as well?
See, since I happen to be one of the senior doctors in the country, many policymakers do talk to me about what can be done to improve the healthcare problems of the country, and wherever it was possible, I used to give my suggestions, and most of them do take them seriously, and some of them do implement it. Yes.
But how do you personally feel as a leading doctor of this country, how India grappled with COVID or post-COVID? Do you think that India's vaccination or India's ability to go for the indigenous vaccines did put the country in good stead?
I believe among all the countries which fought COVID, India has done the best. The reason is we are a country of 1.4 billion people. All the other countries are tiny compared to us. So the quantum of problem what we faced is significantly higher than them. And compared to what they thought we will land in the trouble, we have done the best. And our mortality compared to the population we have is definitely the least compared to other countries. So I am very, very happy with the way we have handled COVID. We should be very proud of it.
Also, I learned that when it comes to expansion, you also have an incredible sense how to team and pair with world's best institutes. For example, IIT Kanpur, I learned. So, what is this model going to be like?
See, IIT Kanpur is one of the most progressive institutions. I'm not sure whether you are aware, within the next hopefully 1.5 to 2 years' time, we will have one of the most advanced artificial hearts in the world, developed by the engineers and the team from IIT Kanpur. So the IIT Kanpur is very keen to build a multi-specialty hospital dealing with all the complexity of heart surgery, heart treatment, brain treatment, cancer treatment. And it's an ideal place because they have brilliant minds.
And your role will be to.
We are advising them on how to go about it, yes.
And I also believe, Dr. Shetty, that your organization is also going to roll out insurance plans in the in this country as well. I'm sure that's a very brilliant idea to make sure the affordable health service, because people look up to you, and when this sort of a proposal goes from Dr. Shetty, that would mean a lot to this country's health welfare.
See, we have about 200 to 300 million missing middle population who cannot afford to pay for the health care. If they require to admit their relative, the loved ones to the hospital, they don't have the money, but they can afford a affordable health insurance. So we thought we should be in that area. So we are in the process of doing all the formalities, and God willing, we will become a health insurance company.
As far as the network of your hospitals is concerned, you seem to be expanding on a very bright note, which speaks volumes about the faith the people have in your services and your leadership skills. Are we going to see Dr. Shetty visiting many prominent hospitals in Delhi, Bombay in near future as well? Now that you are aging as well, but people see you with a lot of wisdom and a lot of hopes. So are we going to see that often in future as well, that you want to relax and also step out of Karnataka to the bigger cities as well?
We do have hospitals in multiple locations in India. We also have hospitals outside India. In Cayman Island, we have a large hospital. We are expanding. So essentially, healthcare has to expand because the quality healthcare, even today, is accessible, affordable to a small percentage of the people. We need to change, and that is my mission.
Dr. Shetty, if I have to talk about 30-year-old case where you performed surgery on a young kid, to now some of the incredible and momentous feats that you have scored, which will be your most satisfying or gratifying surgery, or the guidance to a surgery in the last few years or so, which has become very close to your heart, something that you can share for our viewers as well?
See, every surgery surgeons are essentially artists, and every surgery is an opportunity for us to enjoy the process of creating something magical, mystical, which will transform people's life. It's very heartening for us to see somebody who has been told that there is no hope to survive, like patients who suffer from a condition called pulmonary embolism.
Correct.
For which generally they die if nothing is done.
Right.
They're on oxygen at home, gasping for breath, and everyone's saying they're going to die. And then we operate on them, they walk out of the hospital without oxygen. And after 6 months, they send you a photograph of them hiking or scuba diving. That's what makes us worth living.
So, at the moment, if I may ask you this question, out of curiosity, how much does a minimum surgery cost today at Narayana Hospital, a heart surgery, and how far the costs escalate at your hospital?
See, a heart surgery under the government schemes on a child may cost 90,000 or 1 lakh rupees. For your information, the first heart surgery I did in Calcutta, I think 33 years ago, the patient paid 1.5 lakh rupees, 33 years ago. And today we are doing the more complex operation at 90,000, less than 1 lakh rupees. And this is how the cost of healthcare has come down in this country.
So, what's the reason that your hospital alone drives such low-cost surgeries. Not many other hospital chains, the big hospital chains in the metropolitan cities like Delhi, Bombay can afford to do that. Why is that your signature hospital has been able to perform these surgeries at such low costs?
About 14% of the heart surgery done in India is done by our group. So we have naturally the economy of scale. And our business model is really built on working class people who may not have too much of money to pay. That's a business model and that's how it works.
Correct. But I also believe that you have a huge range of doctors looking your hospitals, and many of them are still willing to sort of shift their cushy jobs to work under you, because everybody wants to sort of take your experience and guidance.
Thank you. The advantage, the doctors who work here, if they come across a poor patient who may not have huge amount of money to pay, they have the freedom to decide on what money he can pay, and we do it. If they don't have money, we arrange the money. So that is something which doctors enjoy.
One quick message before I finish this interview from you. How would you see tomorrow's elections, and what would be your appeal to the voters, especially the young voters and the old voters your age?
My request to all the voters is to get up early in the morning, go back to the polling booth and cast your vote. We are the greatest democracy in the world, and democracy's foundation is built on our ability to cast our vote. And please do not forget to give your vote.
Thank you so much, Dr. Shetty, for speaking to us at this crucial juncture when your state is going to elect a new government or repeat the government. It's up to the democracy. And we value your time, and we wish you all the best for what you are and the services that you have offered. So that was Dr. Shetty speaking to the New Indian on the elections tomorrow and the services which he has offered to this country over an incredible career that he has had, and become a beacon of hope for many innocent souls in India.
For such fine news breaks and video features from ground on your mobile phones, don't forget to subscribe to our channel, The New Indian, by clicking on the bell icon. Also, follow us on the social media handles on Instagram, Twitter, Facebook and Coup.